Good afternoon. In the last lecture, we discussed about plan construction of Nuisance therapeutic pocketbook. In that, we discussed there are 7 chapters in BTPB. The first one is mind and intellect. Then the second section or second chapter in this repertoire is parts of body and organ. Then third is sensation and complaints. The fourth section is sleep and dreams. Sixth section is alteration in the state of health. Then seventh section, the last section or chapter in this repertoire is relationship of remedies. So in this way, these are the 7 main parts or sections in this repertoire, and under parts of the body and organs, there are 32 subchapters or sections which are arranged according to anatomical division of the body according to Hahnemannian scheme, from which start from head section, subsection and ends on lower extremities. So in this way, in second part, that is parts of body and organ, there are about 32 subsections. Then there is arrangement of rubrics. It is not according to his philosophy, that is location, sensation, modality and concomitant. Rubrics which are having no definite order. General chapters are alphabetical. Particular parts are mostly anatomical, but some are mixed with sensation. Then in chapter head, there are 4 subchapters, that is internal head, internal head sides and external head sides. For eyes, there is 2 subchapters, that is eyes and visions. Under ears, there are again 2 subchapters, ears and hearing. Under nose, again 2 subchapters, nose and smell. Under face, also 2 subchapters, face and locations of sensations. Under mouth and fauces, there are 5 subsections, that is mouth and fauces, hunger and thirst, taste, eructation, nausea and vomiting. Then under abdomen, there are 7 subsections, that is internal abdomen, external abdomen, abdomen sides, hypochondriac sides, then abdominal rings, flatulency and stool. Then under urinary organ, there are 3 subsections, that is urinary organs, urine and urination. Under sexual organs, there are 3 subsections, that is sexual organs, euphoria and menstruation. Under respiration, there are again 3 subsections, that is respiration, cough and air passages. Under external throat and neck, there are 2 subsections, that is external throat and neck, neck and nape of neck. Under extremities, there are 2 subsections, that is upper extremity and lower extremity. In this way, these 12 chapters out of 23, there are sub-chapters under these chapters. Then there are also some misplaced rubrics in this. Out of 32 chapters, there are these 12 chapters have subsections, different subsections. Then There are some misplaced rubrics we found in this repertory. Some examples are given in this slide, that is paralysis of optic nerve, which we found under vision, then beard, which we found under external head, parotid glands under ear, eyes protruding sunken under face, desire and aversion under hunger and thirst, then anus, hemorrhoids, stool, perineum under stool, then abortion under menstruation. Now in this section, in this repertory, under the section or under the part sensation and complaints, there are about 825 rubrics. And we discussed all about each part or each section, that is how many rubrics are there, how many pages that section covered, then how the rubrics are arranged in that section. The first, sensation and complaints in general, it is given, then sensation and complaints of glands, sensation and complaints related to bones, and sensation and complaints related to skin, it was given. Sensations are not merely from mind, but merely the sensations happening in the body. Under subjective symptoms, feeling better for the whole being is mentioned. For example, desire for cold air, intolerance of clothing. In this way, under subjective symptoms, feelings related to whole person, it was given. Symptoms of affinity. Symptoms on left side, right side, crosswise, it is given in this section, sensation and complaints. Then symptoms covering clinical conditions, that is apoplexy, consumption, convulsions, paralysis. It is also given in this section, sensations and complaints. And also we found some misplaced rubrics in this section, like air aversion to, desire for open air, frozen limbs, hair falling, and nails in skin. These are some misplaced rubrics under this section, sensation and complaints. Then sleep and dream section. In this section also, all the rubrics, they are arranged alphabetically. Then under this section, subrubrics like sleep, position in sleep, dreams, yawning, sleepiness, sleeplessness, positions in sleep, dreams are well mentioned in this section, that is sleep and dreams. Then fever section. In this section, the rubrics, they are arranged, they are not arranged in alphabetical order. Number of subsections are 7, as we discussed earlier. that is circulation of blood, cold stage, coldness, heat, perspiration, compound fever, and concomitant complaints related to fever. So in this way, the rubrics, they are not arranged alphabetically, but there are 7 subsections, and with the help of these subsections we can easily find out the symptoms related to different stages of the fever easily. So the subsections under fever section are circulation of blood, cold stage, coldness, heat, perspiration, compound fever, concomitant complaints. Circulation, in that anemia, congestion, pulse symptom, then cold stage, coldness and heat, variations of symptoms, then perspiration, partwise it was given, then compound fever, all permutations and combinations, and concomitant symptoms, alternating and associated symptoms. Misplaced rubric in this section fever we found is anemia. It was given under the section or under the part that is fever. Then comes the next part of or next chapter of this repertory, that is alterations in the state of health. The time modalities, it was given first aggravations and then ameliorations it was given, and the time was followed clockwise. Arrangement of other rubrics alphabetically. There are 2 subsections in this section, that is aggravation and amelioration. Aggravation subsection has more number of rubrics than amelioration subsection. Aggravation subsection has some rubrics of poisoning. For example, arsenic fumes, aggravated by arsenic fumes, aggravated by coal gas, aggravated by intoxication. In this way, we found in this repertory more aggravation rubrics related to aggravation than rubrics related to amelioration. Misplaced rubrics in this chapter or section are burns, children remedy, nursing children, disordered stomach, drinkers for heart, injuries, lying in woman, suppression of eruption, suppression of nasal catarrh, sweat, pregnancy, stone cutters fall, and woman fall. So these are some misplaced rubrics which we found under this alteration in state of health section. Then relationship of remedy. This is the last section or 7th section in this repertory, and this is most useful section, especially it is clinically very much useful section for second prescription as well as during further follow-ups. And Dr. Kent, he also, as he was against the principles of Dr. Boni Hussain, but then also he appreciated Dr. Boni Hussain's this work, that is relationship of remedy. Number of drugs in this section are 141. Arrangement of remedies, they are alphabetical and it is based on 7 sections of BTPB. Typography which was used in this book, in this section is same as the main book. Each remedy is given relationship with other remedies based on mind, localities, sensations, glands, bone, skin, sleep and dreams, blood, circulation and fever, aggravated by time and circumstances, other remedies, antidotes, injurious remedies, that is ammonium carb, arnica, belladonna. So, under this section, each remedy is given relationship with the other remedies based on these factors, these following factors. This section, this chapter, relationship of remedies, it is very much useful chapter used for studying, sorry, it is used for studying relationship of remedies under different levels. For example, mind, sensations and modalities. Helps to find out close running medicines, thought for future follow-ups, to find out the second medicine if the first one, though it was indicated but doesn't meet with the expectation in a given period of time, at, at that time in such situation we have to change medicine, we have to find out the second medicine, and for this purpose this chapter is very much useful. Sometimes a deep acting medicine can be given although indicated in those cases an analog can be found out. Helps in studying various relationships of remedies. Then scope of BTPB. Though less number of mental and strong emotions are given, but Dr. Poning Hussain, he does not use as well as he does not advise to use these mental symptoms or these symptoms related to emotion for proper repertorization. But for the final selection of the remedy for during final differentiation, these mental symptoms as well as symptoms related to emotions, they are useful. More modalities and concomitants we found in this repertory. The remedy relationship section, this is very much useful section. Then in this repertory 5 grades are given by Dr. Hahnemann to the medicines, and it helps in better differentiation. Then direct comprehensible rubrics we found. better in sites representation, index with neophytes we found in this repertory. Also the pathological or objective symptoms we found in this small repertory or in this small book. It is very small and handy and very useful for bedside practice. As well as it is used to study the materia medica. As the repertory, we know this repertory, the BTPB, it is based on complete symptom and concomitants. While constructing this repertory, the plan and construction follows the same principles and the whole book can be divided into location, sensation and modalities. This makes it easy for the practitioners to find out the rubric. Only the chapters under second part, it was given the 32 subchapters, it was given or arranged according to Hahnemannian scheme, but otherwise we followed the plan and construction according to the principles which are given by Dr. Boning Hussain, that is complete symptom and concomitant. His work, that is relationship of remedy section, this is a unique work and this chapter is also unique and very much useful in clinical point of view. The information whatever collected in this book by Dr. Boning Hussain, it was mainly derived from Hahnemannian work, so it is most authentic book as well as some information which is varied by Boning Hussain in clinical practice. Then under sensation and modalities chapter, we found several useful rubrics related to various parts as well as the whole person. This unique arrangement only found in therapeutic pocketbook. The repertory has five type of typography. As we discussed, there is 5 gradations which help in better differentiation. And with the help of these 5 type of gradation, 5 type of typography, we can easily find out the intensity of the symptom in that particular remedy. As there are very less number of mental symptoms as well as symptoms related to emotions in this repertory, and these symptoms related to mind and emotions we found at two places in this repertory under mind rubric, under mind and under modalities, that is aggravation and amelioration. We found the rubrics related to mind and emotions under these two chapters or two subsections. While constructing his repertory, he tried to write down the concomitants, but not under all chapter there is concomitants given by Dr. Bonin Hussain. But few chapters which contain detailed concomitants which are given at the end of the chapter. As this repertory or as Bonin Hussein's repertories, all we know these are the relatively initial repertories. As Dr. Bonin Hussain, he was called as father of homeopathy, father of repertories, because his first repertory was published, which was written by Dr. Bonin Hussain, and with as it is the initial repertory, but then also it contained a systematic arrangement as well as the detailed information on various parts or locations, sensation, modality, and relationship of remedy. So these are some points related to scope of BTPB or special features of BTPB. It is also asked what is the scope of BTPB for short note, as well as it may ask special features of BTPB. So it is nothing but the same. Then adaptability of this repertory, in which cases we can adapt or we can use this repertory. The cases which are having complete symptom, then cases having prominent sensation and modalities, cases with prominent concomitants, then paucity of symptoms, where we cannot, the case or the symptoms, it was, the patient was not get completely cured, as well as the most acute complaints it get reduced. There is no aggravation as well as amelioration. The condition of the patient, it remain as it is, means the cases which is having the case which is having the paucity of symptom, then the cases with scattered modalities and no PQRS symptom, which is lacking, or the general symptoms we found less general symptoms in the case. All these situations, in all these situations we can use the bony nuisance therapeutic pocketbook for repertorization. So which are these cases in which we can use BTPB? The cases where we get the complete symptom or prominent sensation and modalities or prominent concomitants, or if there is paucity of symptoms, as well as the cases in which the modalities are scattered and we cannot found any PQRS symptom. The case which is lacking in generals. So in these type of cases, we can use this repertory, this BTPB for repertorization purpose. So this is all about the adaptability of BTPB, that means in which cases or where we can use BTPB for repertorization, as well as special features of BTPB.